Informed Pregnancy and Parenting Podcast. I'm your host, Dr. Elliot Berlin, and I'm joined by three guests today. Dr. Allison Hill has been a board-certified obstetrician-gynecologist since 2000 and has authored the fascinating book, Your Pregnancy, Your Way. Everything you need to know about natural pregnancy and childbirth, which we covered extensively in a previous episode. Welcome back.
Thank you for having me.
Bliss Young supports families on their parenthood journey as a home birth midwife and childbirth educator, placenta encapsulator, and a natural birth and family consultant. I have the honor and privilege of working with Bliss on our team at Berlin Wellness Group. And after her birth, one of our clients recently referred to us as the dynamic duo of labor support, in which case I am definitely Robin to your Batman, and everyone agrees that you look better in tights.
Thanks for having me.
Yeah, thanks for being here. Ashley Williams Dodson, affectionately known to me as Smashley, is a wife, mother of two, and film and TV actor. And she's also a trained labor support doula. She has appeared on two of my favorite TV shows, As the World Turns.
Oh, the truth comes out.
I'm a big fan. And The Jim Gaffigan Show. And we randomly met for a second at a taping of Good Morning Miami back in 2004.
I always forget that.
You do?
Yeah.
I'll never forget that.
Oh,
Welcome
even
to
with the face
podcast.
blindness, you remember that. That's amazing.
Yeah, it's weird. I've been to 3 sitcom tapings in my life. At one of them, Good Morning Miami,
Yeah.
I met you first second because my wife went to use the restroom and we walked by and you're like, oh, hi.
I just stopped you and said hi.
You were just,
Why did I do that?
I think she was waiting to go somewhere and she smiled and you said hi. I don't know why.
Oh, that's funny.
Yeah, and I was like, wow.
That was like surprisingly friendly of me for the time, which
Well, I was
little
thinking the
shy
same
at the
thing. I was
time.
like, that's one of the actors. That's really
Right.
cool. She said hi to you.
that's funny.
And then I forgot all about it. Okay, then we went to a taping of Quintuplets.
I wasn't there.
You were not there, but you know who was there and in it? Sarah Wright Olson,
No way.
Yeah.
Now it all is coming full circle.
who also later became a doula.
Yep.
And I also met later in like real life. And the last one that we went to was in the last season of Frasier. And I just heard that Kelsey Grammer's becoming a doula. That's not true at all.
I was like, wow.
I want to talk about a lot of things, but I will say this. One thing is that I was just out of birth maybe 2 weeks ago, and Jim Gaffigan was there.
He was on, they were watching.
I put it on because she could not relax.
And did she start laughing?
We were dying laughing. We put on
What bit was it?
Mr. Universe, which starts off with his home birth. You know, if you want to know what it's like to have 4 kids, just picture yourself
5, yeah.
drowning. 5? Oh, well, 4 at the time. Yeah.
And then someone
And
hands
someone
you a
hands you a
baby.
baby. Yeah. It was just perfect. I mean, it totally helped her get in the zone.
His wife told me a funny story from their first home birth, which was not a planned home birth. Actually, well, whatever. Their first home birth, basically, they started realizing they were going to have the baby really soon, and she and the midwife went into the bathroom, and he said, "What can I do to prepare?" And they said, "Just sort of put some sort of cover over the couch and a couple of other things." And he said, "Okay." And they came back in like 10 minutes later, and he had covered everything in saran wrap, like everything, like pictures and chairs and everything.
Oh, that's funny. So you have 2 kids.
Yeah.
You almost say that like you don't really believe it. Like,
I don't.
Thanks for reminding me.
I totally don't. I'm holding one of them in my arms, which you can't see.
You're holding one in your arms.
And the other one's watching Winnie the Pooh
right
on the
behind
floor.
me watching Pooh. It's amazing. You travel everywhere. And you just came from an audition with your whole family, dragging along with you. So I want to just talk a little bit about you. Like, where did you come from? And when did you come to LA? When did you get into acting? And
Oh dear,
and
we're
how did
going
that
deep, huh?
somehow become
This
a?
is so Mark Maron of you.
Thank you.
I
practicing.
am from New York. I
You grew up in New York?
Yeah.
Because you have no New York.
No, because I went to theater school and they drilled that
You have to
out of
wash
me.
it out
Yeah, now I
with
have
soap.
like I have sort of the perfect middle, like American accent.
Yeah.
Standard American, I guess it's called. Whatever. So went to school in Boston, and then
Another accent-rich city.
Right. Oh God, such a good accent. And then I went to New York and I did a play and decided to come out here for pilot season, and then I stayed. And I came out here and I booked a pilot, and the pilot got picked up, and then I stayed for 13 years.
So you studied theater before that in Boston?
I went to theater school in Boston. Yeah, I went to Boston University. And, and then I graduated, did a summer at Williamstown, went to New York, did a play, came out here, did a pilot, and then it was Good Morning Miami, and that's when I met you.
And then everything changed for the better. Yeah, your real life began. Well, that's good in a nutshell. So where in there, because...
Oh, when did I become a doula?
Because when I met you, I think you were already a doula.
I was, yeah.
When I met you in real life, not at Good Morning.
Right. I was dropped by my agent when I had a bad year as an actor, which happens. Mm-hmm. And I had wanted to have a baby, but I wasn't ready. I had met Neil, who's my husband, but I just wasn't there yet. I wasn't feeling it quite yet. And and then I actually attended my sister's birth by accident. I went to go visit her and hang out with her, and her water broke one night. And so what began was a very long sort of, as they say, cascade of interventions at the hospital, because I didn't know anything, and her water broke, and we started screaming, and we got in the car and raced to the hospital. And
was she towards the end?
Yeah, she was like 5 days before her due date or something.
So it was like very plausible that might happen.
Totally. Mm-hmm. But it was really fun, and I was so excited. I can't believe I'm going to be here for this. This is amazing, and I was really surprised by hospital policy when it came to interventions, and she was very happy with her birth, and so that's the most important thing. But I was startled by a lot of what I saw, and I came home and announced to my husband that I was never going to have a kid. And he said, "Well, no, I want to," and he was actually the one that said, there are these birth assistants that you can hire to advocate for you in the hospital. And that was really the first time I started researching it. Right around then, Business Being Born had come out, and I immediately watched that, and then I sort of was on the train, And my best friend is a midwife in San Francisco, one of my best friends.
Your other best friend?
Well, but other than you and the two of you. So
Gus thought that was funny.
Gus is
it's Winnie the Pooh. Yeah.
So then I started. I think I actually had an easier time becoming certified as a doula than somebody who starts now, because it wasn't sort of like as hip at the time. And I wrote a letter to like 15 doulas in LA, like, top of the line doulas, and just asked if I could be their assistant and
just
if they would mentor me.
Oh.
Yeah, and none of them responded except for Tracy Hartley.
Oh, she's the best mentor.
Yeah. She said, well, let's have coffee. And we sat down and we started talking right away about dog training. What?
So LA.
Let's have coffee.
Let's have coffee.
Yeah. And
talk about dog training.
We totally hit it off. We both are obsessed with training dogs, which was another whole life I had. And she said, well, I have my leg's been hurting recently. So I could really, I'm having trouble doing long births. So I could really use your help. And so I attended like 13 births with her.
Wow.
Yeah. And we worked really well together. I actually attended a birth where Dr. Hill was our OB.
And I know that client.
Yeah, great client. Really cool birth. That was a really cool birth. But it was really fun. I learned so much.
But you also then must have gotten to see birth from another angle than like your sister's experience.
Well, yeah.
Yeah.
That was amazing, especially with doctors like Dr. Hill around who really, I think, work hard to create options.
So let's pause for a second because Bliss has gone through a kind of a really fascinating transformation. And Dr. Hill, you must also, because when you trained as an OBGYN, did you see the business of being born?
Yes, but I didn't see it right when it first came out. Like it had been out for a little while before I watched it.
So as a practicing OB, like how do you react to that film?
Well, when I first saw
At
it,
the
which was
time.
was a while ago, I was still, we're trained in such a uniform way across the country that, we're kind of trained to put down home birth. We're told by the American College of OBGYN that we should tell our patients not to do it, and that's still the case.
Right.
And so,
I didn't know that.
Yeah. And so there's, so there's always a bias, so that when it first came out, I was kind of defensive, about it.
But that's what I would expect.
Yeah.
Home birth aside, they're making the case that hospital birth is prone to going this way.
Right.
That you're going to get interventions whether you need them or not, whether you want them or not.
Right. And so I was very kind of defensive about it and very like, well, that is because sometimes things go wrong and stuff like that. But I will say, like, the longer that I did it, the more real that actually became. I mean, I saw it from the other side after a while. But it took a long time. Like, I would say I was in practice for at least 10 years before I could see the downside to what I had been taught. Like, it took that long to see through it.
I think it's hard when you have new technology and innovation in healthcare in particular. You want to sort of use it. It's exciting. It's like a new app. And
Well,
it's
and
like,
you
we can do this now.
You really have the best intentions.
Yeah.
The truth is, I think OBs want everybody's baby to be born healthy. I mean, that truly is everybody's goal in the long run. It's just that they forget that there are negative consequences to some of the things that we do. And it's hard for people to admit that when it's been, we've kind of been programmed that way for so many years. Continuous fetal monitoring to me is probably the biggest example of that, in that, that was a technology that people thought, this is going to save babies' lives, this is going to decrease cerebral palsy rates, this is going to decrease the risks of, brain damage. And everybody was so excited about it that nobody thought of the other side. And as it turns out, the risks of cerebral palsy and brain damage are exactly the same as they were before we started doing continuous fetal monitoring.
Right.
And I'm not talking about intermittent monitoring. I'm talking about continuous monitoring
Throughout the
entire thing. But when those first studies came out, of which one of my professors at the county hospital was one of the inventors of that technology.
Oh, wow.
And so Dr. Richard Paul, who's this amazing obstetrician, but that was like such a huge innovation, and everybody just got on board, and we're going to save all these babies. And nobody, it didn't even dawn on anybody at the time. Like, well, what if we actually do all of this, and then we end up having C-sections for everybody?
Right, so I think a quick study of obstetric history over the past century is that something new comes out, everybody jumps on really quick. But even when we realize that there's a problem or we need to use that sparingly, it doesn't shift back very quickly.
It doesn't shift back at all. And and American College of OBGYN says blatantly that continuous electronic fetal monitoring does not improve outcomes, but we do it anyway. And so...
Is the reason that they do it anyway because insurance companies dictate a lot of it, and
it's not so much insurance companies as it is the doctor is afraid. We've been made really afraid that if you don't jump on every little idiosyncrasy,
and there's evidence of it,
and then you've got this document, then you
There's
have
a
no
record.
leg
you
to stand
should
on.
want it the other way, because
Well,
that
I
little
know.
strip is evidence of everything. But,
I know.
But what happens is, I think in malpractice, you're always looked at as, did you do everything you could have done? Even if
were
doing
there any
more,
signs of danger?
Well, even if doing
you had
more
done
doesn't really help, and sometimes doing more actually intervening could go the other way, do more harm.
Right. But you
they
just
still
have
look like, did you do everything you could
Right,
have done?
because you
And
just
then
and I always say,
the
like,
prosecution can say, you could have done this,
Right.
and you didn't do it. And you could say all day, but that doesn't do anything, and they don't care.
Right.
You
you can always...
You're rewarded for doing more.
You can always, if you don't do a C-section, you can be faulted.
Right.
And if you do, you're probably fine. And the problem is that we'll never know what the outcome would have been if you
Right.
would have went the other way.
I think a simple example is just going past the due date.
Yeah.
So if you do a cesarean just because someone went past the due date with no other indicators, and something goes wrong, you're still going to be okay, because you can make the case she went past. She was late.
Right.
And we tried to save her, and this is a normal consequence of doing a cesarean. But if she goes past her due date, which is not an indication by itself for cesarean, and don't do one, and something goes wrong, then they can come and say, you could have helped this person. You could have induced her, or you could have done a cesarean with her.
Right.
And then, Bliss, you kind of went through this transformation from through your own births, but then also from becoming the business partner in a birthing center to saying, hell, I got to get in on this. Or something
or
like
out
that.
of it.
Well, in on the birthing side instead of the business side.
Yes. Yeah. It took me a long time to get
Out of the business of being born and into the birthing.
into the room where all the magic happens. And the first time I caught a baby, I thought, God, what took me so long? So I really love it. Wow. Yeah, it's really a beautiful experience.
Well, you're the Batman to my Robin.
Yeah.
All right. So, Ashley, with that kind of experience, when you get pregnant yourself, now you have a lot of stuff to bring into your own pregnancy and birth.
Yeah. Interesting what knowledge does when it's your turn. Because I was a lot more scared, I think, than the average bear to give birth. Because I'd seen a lot go down, and I'd seen a lot of condescension from OBs, and I was too scared to go to a hospital.
Oh, really?
Yeah. I'd attended 52 births, and and I just had seen across the line there were some incredible OBs, and then there were a lot of scary nurses. I wouldn't have wanted to talk to me that way, and hospital policy that freaked me out, and it was just undeniable that a home birth was for me. What's happening?
I'm just taking a picture.
Why?
It is so cute, that little thing on your your little sweet little baby there.
Little thing. That
He's
little
pretty
thing.
cute, right?
He's so cute.
He's a cute guy.
Sorry, I
really
was
like him.
distracted. You were saying something meaningful, and I'm just looking
Yeah,
at
I
his
was
sweet
like, what
little
is
cheeks.
we're documenting.
I gotta eat those cheeks.
And my husband luckily was totally on board, and
For having a home birth?
yeah, and then I think I also at that point I'd been a doula for 7 years, and I'd been sort of collecting resources, so I knew exactly who I wanted to be my midwife. I knew exactly who I wanted my doula to be. I knew I wanted you there. I knew I wanted Crane to back us up. I knew I wanted Fishbein on the line.
I think it was years before you got pregnant, and you were like...
I was like, here's my plan. Yeah.
Even for me, I don't even think I was really going to birth at that time. And you're like, yeah,
I think I want you to come.
You're going to come do a couple of hours of massage
I said,
with
I'm
me.
going to have a big pot of soup, and I just want people to come by and have food, and you can adjust me, and, I wanted, my dog's there, and I just,
That was great for me, because I love soup.
You do? Yeah. That was what I thought of you.
I love that idea.
Yeah.
That's amazing.
Yeah. So, and then when it came down to it, we had what we called the Avengers of birth teams. Just like
I'm into all these different, all these different roles. How did your labor start?
My water broke.
Oh.
Yeah.
It runs in the family.
It does. And it happened for me both times. So, yeah. It was like 7:30 at night. We were picking out decals for the nursery, and I was in child's pose on the bed, and I just
That's appropriate.
I felt yeah, right. I felt like a poof. And when I stood up, all this water started coming out, and my husband and I just started screaming, and we ran into the bathroom because I was like, look, new carpet. We just got from the nursery. And we just started screaming and laughing, and then I'd laugh and more water would come out, and then we started making out, and then more water came out, and it was just everything you want, just crying and laughing and making out.
Aww.
And just amniotic fluid everywhere. It was awesome.
I love
awesome. That. And then we texted my midwives and my doula, and the midwives happened to have been really close by. And I was starving. So I immediately threw some acorn squash into the oven, and the midwives were on their way over, and I just wanted all my clothes off. So I just put on like a sports bra and this pair of underwear that said under construction, which was not, I was a coincidence that the underwear said that, but it turned out later, no. And then there was so much amniotic fluid that we took a Chuck's pad and we put it basically coming up the front of my underwear and up the back of my underwear, and I was in a sports bra, and then the acorn squash started burning.
Oh.
And so I open up the oven, and all this smoke starts billowing out, and right then the doorbell rings, and it's my midwives, and they just, I opened the door and was like, we're here.
It's happening.
That's an awesome visual.
Yeah. There's just smoke everywhere. I mean, everywhere. You could not get it out because we've been smoking for a long time, and we were watching Top Chef or something. Anyway, so then they, confirmed that the, water had broken, and
Are you having contractions then?
No. I was sort of crampy, but no. So, and then I looked at my husband and I said, okay, we're a little in for it. Like, this isn't ideal. It's now, 10 o'clock at night, and, I'm tired. We've been going all day, so we got to go to bed. And I started feeling contractions, but I didn't want to tell anybody. And then Sherry went to your house to sleep over.
Oh,
Remember
right.
that?
Your doula came to my house.
My doula came to Dr. Berlin's house to sleep on his couch, but didn't tell me because she had a feeling it was going to happen.
Exactly.
And I didn't want to tell anybody I was feeling contractions because my biggest fear was prodromal labor. And so I was like, well, I'm going to psych myself out. And so I was like, I'm just going to pretend it's not happening.
Prodromal labor is just where you sort of feel like you're in labor, but it's not progressing. And
right.
It can go on for days.
For days and days. And that was my biggest fear because I'd seen that with so many clients. So
I would say it's doing something, though.
What?
Well, it's not doing what you're hoping it'll do. What's it doing? What are you saying it's doing?
It's preparing the cervix to open. It's softening. It's shortening. It's doing
but
something.
Sometimes it's
just not
super,
necessarily.
super painful for people.
And long.
Then
Yeah.
And then it's like 3 days of really intolerable pain.
Yeah.
It's
and
not
I
really
didn't want
dilating the cervix.
It can, but slowly, or it can be
But
effacing.
it looks like, I've never experienced it. It looks like the pattern looks like it should be dilating the cervix, and you assume kind of like it is, but then 35 hours later you're not really dilating.
And if you're sort of measuring in your head, which I tend to do naturally,
no kidding,
you're going, at this point I must be 7, and then you get to the hospital and you're not dilated at all, and that sounded like a nightmare to me.
Yeah.
So I just decided to lie to everybody and tell them that I wasn't having contractions.
But Sherry saw through you, and I live right near you, so she stayed, and she lives far.
And it was smart because at about 2:30 in the morning, I said, I need Sherry. I sort of squawked it out. And she came, and I don't really remember the labor until the sun came up, and then I remember what happened, which was all the midwives got there, and it was so fun,
You had a fun team.
Oh, my God, it was so fun.
I mean, there was a point where they just busted out into dance party.
We were all dancing and laughing.
Crazy dance party.
I mean, the best birth ever.
It was great.
And I remember your dog was on the treadmill.
My dog was on the treadmill. Well, Phil is my dog. And Phil has some emotional issues that really come out if he doesn't exercise, which, funnily enough, is the same thing with me. So we put him on the treadmill every morning for 90 minutes on an incline, and then he becomes a sane dog. So we had to put him on the treadmill during my labor too.
So everyone's dancing. Phil's on the treadmill.
So fun.
Music is blaring.
So fun. And then I said, I really want to know where I am, because if this is prodromal and I'm 1 centimeter, I got to go get an epidural. And Beth said, fair enough, let's check you. And I was 9. And then it got even more fun. And really soon I was 10, and I said, yeah, I have the urge to push, which I kind of didn't. But I was just so excited.
You wanted to.
We were having so
push.
much fun, and I just was like, yeah, I can poop. Let's go. And then I started pushing, and then I pushed for 6 hours.
Yeah.
Yeah.
I feel like I left maybe 2 hours into that or something like that.
But what you did was really helpful. That was all really helpful too. Like, we were making progress. It was just not fast progress.
Yeah. You had this weird pain on the inside of your leg with every contraction.
I still remember that.
I remember I missed one of that because afterwards you were like,
so
get in there and release
I
that.
wanted you to dig at it with a spoon. Do you remember? Get a spoon.
I'm a pretty big guy. I was really in there,
and
you're like,
you're not
deeper.
committing. Commit.
And then I had a pee, so I missed one. And you're like, where are you?
What's this not about you?
But what also was sort of beautiful That I thought
He's
you were
just
burning.
pooping and
It's okay.
spitting up everywhere.
I mean, he's reliving the story. You said I really felt like I had to poop.
Yeah,
And
totally.
right on cue.
He's just a delight.
What I thought was really beautiful was the music.
Yes.
Music. You had the most wordy music ever.
Yeah, and I knew all the
And
lyrics.
you knew all the lyrics,
Yeah.
and you would just close your eyes, and your mouth was just like right through the contractions. You were just doing the lyrics and totally into it. And Neil was DJing.
Yeah.
It was really cool how you used that music to just meditate and leave your body and let her do what she needed
I
to do.
worked hard on curating the playlist. That was important to me because I feel like it was a lot of songs from my past, and I feel like I'd been preparing for my birth like ardently. Is that the right use of that? Like I'd been very serious about it for years, and sort of bringing back all these memories. It really helped me. Really helped.
That's a great idea.
Yeah, it was
I
great.
mean, I'm always amazed in the hospital, like, people will have on, like, Judge Judy in the background. You know what I mean? And I'm like,
With
really?
an epidural
This
in,
is
then?
sometimes, or not,
Or
you know,
soon
or
enough
some
after that.
terrible
Yeah.
show is on
Right.
TV, and I'm like, what are we doing here?
Yeah.
You know,
Right.
I mean,
Just-
the idea of kind of like making your own soundtrack to it and like thinking about that ahead of time, almost so that it can cue you to
Yeah.
certain emotions and relaxation.
exactly
That's
I
what
mean,
it looked like. That's what
that's
it looked
really
like.
a great thing
It
to
was
do.
so cool.
Thanks, Dr. Hill. I'm glad you like my idea.
I like that idea more than Judge Judy. I was always amazed. I'm like, turn that off. Are you kidding me? Like, or Montel Williams, or
no
like
one should be judging in this room.
That's right.
No, everybody's
Don't
so
judge
Jerry
me.
Springer. Like, I'm like, oh my gosh, please, can we?
We just did one, and it was back-to-back episodes of Keeping Up with the Kardashians.
Oh my
Ooh,
gosh,
that
see,
sounds gross.
yeah.
I mean, no judgment. You know what? Whatever works.
Yeah, yeah. If that's your happy place, then go to it.
Sure.
So 6 hours of pushing.
Yeah, and so
That's a
after
lot.
about
Is that a lot? I know you guys.
that's a lot.
That's a lot. I mean, that usually wouldn't happen in a hospital because somebody would throw in the towel,
Right.
you know? Because
Is there a policy on that?
Well, the heart tones, I will say, the heart tones were perfect the entire
Right.
time, which was a factor for me.
there isn't a policy
midwives.
by the hospital, but you know, again, if you go back to the ACOG guidelines,
Yeah.
it's 3 hours kind of max, and doctors start getting really scared at that point.
After 3.
After 2 sometimes, depending on the situation. And they're afraid that if they keep going and the person has a shoulder dystocia,
Or hemorrhage. Or
there's no grounds to support what they did. None. And if the child is injured or something, we're so afraid of
It's
it.
a fear.
It is
It's
a
a fear.
huge fear. Shoulder dystocia is one of the biggest fears.
Well, interesting
And
that you mentioned
Funnily
that.
enough.
Yeah.
Yeah.
Foreshadowing.
So what happened after?
So 3.5 hours in, I said, how we doing? And they said, listen, heart tones are good. If you feel okay, we're comfortable. You're making progress, but it's slow. And I said, well, let me take a nap. Let me just kind of breathe through and just lie there and take a nap. We called one of my best friends in San Francisco, and I checked in. I said, am I crazy? 3.5 hours of pushing, And she said, I think you should rest. I think you should probably eat. I think you should probably take a break. Like, take a little break and see if, And I fell asleep for 30 minutes. And when I woke up, I was like, I want to get in the shower, which I hadn't wanted to do. And I got in the shower and I started talking to Gus. And at that point, I could reach my fingers inside of me and feel his head. It was about there on my...
Which
and
is about an inch if you're not in the room with us right now.
And I started rubbing Gus's head. And I said, Gus, this whole pregnancy's been so fun. It's been such a party. And I can't wait for you to get here. But this isn't fun right now. And I need you to get serious. And I said, there's this bone right here. And I sort of touched my pubic bone and touched his head again. And I said, I need you to dive under this bone. And I need you to do it like right now. Like we need to go right now. And I suddenly had a really, really intense contraction that brought me to my knees. And it was my first kind of pushy contraction. And I felt him go, like I felt like a moment. And I was like, yes, 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 yes. And I look up and my husband, both of his hands are against the glass in the shower and he's just weeping. He's like, I love you, I love you. And I was like, let's do this. And I jumped out of the shower and went into the living room and I was like, get that music on. on the speakers because it had been on these like little piddly speakers in the bedroom. I was like, let's, and that's when I started like really engaging and really sort of committing in a whole new way. And then I think I pushed for another hour. Sorry, guys. I had a band. Do you know what that means? It's like a very thick
a cervical
sort of
band?
cervical band.
What does that mean?
What is that?
Yeah, I mean, it basically just is that there's. Was it a vaginal?
Yeah.
Oh, yeah. So yeah, it's basically a vaginal, like part of the vaginal muscle that just won't give.
Right.
Like it won't.
Is that Neil?
It just won't totally stretch.
Come in.
So it's just this tight.
Right.
Hasn't given way yet.
Yeah, it hasn't given. It's just like it's just stubborn,
More resistant.
So you have a vaginal band, which does sound like a whole bunch of people playing instruments.
What kind of band I want to be in? Which is sort of like a thick area that's it was hard for the baby to push through.
Yeah.
So I also when I went to Bangladesh a couple of years ago and I assisted midwives or I assisted doctors there. And they're very, very liberal with their episiotomies. And I was super traumatized by the amount of episiotomies I saw when I was there. And that was my second biggest fear. But they were like, you have this band. And, I said, well, do you need to cut it? She said, we could cut it or we could pull it. And so basically I had 3 midwives. And each one of them had a finger inside of me. One pulling to the side, one pulling to the other side, one pulling down, and me pulling up. Oh. And that's when Gus crowned. And so we got his head out, and then his shoulders got stuck.
On the band?
I don't know.
Probably not.
Probably not.
Yeah, because they're a lot further up in there.
I think the band was blown at that point.
Yeah.
Yeah.
So on your bones then?
I think.
Yeah, that's usually where shoulder dystocia is on the bone.
Like on the pubic bone?
Yeah.
Can be. Mm-hmm. There's different ways.
Yeah, I don't know.
How soon after the head comes out do we expect the shoulders to come out?
Well, there was this thing he started doing that they called the turtle sign, which is that the head starts to descend and then goes back in, and then starts to descend and goes back in, and he started doing that. Okay. So immediately Beth had me stand up. And she said, push. We said that she started, my husband was like, that was when Beth started parkouring all over the room because none of us had any idea what was happening. I didn't know anything was scary, but Beth said, Ashley, I need you to push really hard. And I stood up and I pushed and he didn't come out. And then I went on to all fours, and I pushed really hard and he didn't come out. And then she flipped me onto my back and I pushed and he didn't come out. And then she reached in to try to get him, and she couldn't get him. So then Julie Anderson reached in and tried again, and she pulled him out. And then
at this point, you still don't know anything's wrong?
Not really. I was pretty out of it.
Yeah, it was a long. It was a long ride up until
kind of in
then.
a trance too. When you're at that stage of labor, the hormones are really at their peak, and there's a lot of that women don't remember right around that time.
I knew about dystocia, but I'd never seen one. I had seen babies in shock before, so that I knew exactly what to do. And so it took him a minute to catch his breath. Or to get his first breath, and that was scary, but then he did, and everything was totally fine. And I wasn't actually traumatized in the moment with fear. I think it was just like any other incredible first moments with your newborn, where he was on my chest and oxytocin was flowing and we were all cheering and crying and talking to him, and I started telling him, we're going to go to New York. I'm on the Jim Gaffigan show, and we're not going to circumcise you. Don't worry. And your name is Gus, and we're adventurers. And, it was awesome.
Sounds blissful.
It was great. It was great.
All All right.
Yeah.
You brought up dystocia, and Dr. Hill brought up dystocia. I want to take a break for just a minute and come back and talk more about what dystocia is and what you do when it happens or if it can be prevented, things like that. Come back and join us in just a moment. And in the meantime, take a second to visit our series on the Real Midwives of Los Angeles, which you can find at therealmidwives.com. Welcome back to the Informed Pregnancy Podcast. I'm your host, Dr. Elliot Berlin. I'm here with our guests, Ashley Williams, Dr. Allison Hill, and midwife Bliss Young. So, Ashley, towards the end of your sort of epic birth journey, things went a little interesting. First of all, the squash burned.
The squash burned. It's delicious once we scraped off the char.
But then also you pushed for what most people, I think, would consider a lengthy push of 6 hours. And then after your baby's head popped out, the shoulders were not forthcoming.
Right.
And it took a whole lot of effort to get those shoulders out. Do you know how long it was between the head and the shoulders?
I know that it said 5:27 in the birth notes. It said 5:27 head born, 5:30 body born. But I don't know what the seconds were there. And I know that seconds are critical when it comes to dystocia.
So 3 minutes?
Well, that was what the record said. But it could have been almost 5:28 and almost 5:29. You know what I mean? I don't really know how long it was.
So, I mean, between Dr. Hill and Bliss, you guys trained for this eventuality.
Right.
And there must be things that you do. Is there a way to know that somebody's at greater risk for that happening?
I would say so. It's basically a shoulder dystocia does mean that the shoulder, the anterior shoulder, the top shoulder gets stuck under the pubic bone. Kind of the sign that could happen is that the pushing phase is taking a really long time. So when pushing takes kind of outside the quote-unquote normal range, we start getting concerned about that. It's also more common for babies who are being born to moms with diabetes. It's more common for babies that have gone past their due date. Basically any situation where the baby may be a little bigger than average. But lots of shoulder dystocias also occur in normal-sized babies. So it's not necessarily only related to big babies.
Is there something about the mother's pelvis that can lead her to it?
Yes and no. The thing about the pelvis is that it really is flexible and dynamic.
If you have a great chiropractor.
Yeah, if you have a great exactly. Versus somebody being really stiff, I mean that if there's not as much flexibility. It's also, we would see it often when if a mom is immobilized during labor and doesn't have the opportunity to move around and allow the baby to rotate. Obviously, that wasn't your case because it sounded like you were
dance party.
That you were, you were. It sounds like very active, but for some moms, like if they're laying on their back the whole time and the baby can't rotate into the right position, but really the big sign is that prolonged pushing phase. Mm-hmm. That is, shoulder dystocia is an obstetrical emergency. There are a small list of bad things that can happen. That the baby can have nerve damage from stretching, especially the nerves in the neck, and can end up paralyzed in one arm, a thing called brachial plexus palsy, in which they can't use their arm for their entire life. Mm-hmm. And then the other big one is that as the baby's head is out, yet the body isn't, the baby isn't getting any oxygen. So the big concern, of course, with that is brain damage, cerebral palsy, and potentially even fetal death.
So it's a significant concern.
It terrifies us.
What do you do when it happens?
So there are certain maneuvers that we do to try to dislodge the shoulder is basically it. So the most common of which is something that we use is called McRoberts maneuver, which is where we have the mom go on her back. We kind of hyperflex the thighs up toward the chest. And
that's how he was born.
Yeah, to kind of really open up the pelvis, and then we just apply like a very like constant like downward traction to try to pop that shoulder out.
Downward traction
on the head and the neck to kind of keep it going down to try to pop that shoulder underneath the pubic bone. And if that doesn't work, we try to turn the baby, like kind of turn the baby one side or the other, to rotate it, the body, so that we can try to, again, just get that shoulder out from underneath the bone. And then the worst possible scenario is we cut open the mom's pubic bone.
Oh, wow.
Yeah, which is all sorts of terrible.
Yeah.
And I've actually never seen that before. It happen in 20 years, even at the county hospital. So
Can I talk about it for just a second?
Yeah, that's what I was going to say. What do we do at home?
Okay. So it's my understanding there are different types of dystocias. The most common one is the one that Allison described. And in the pelvis, the diameter between your sacrum and your pubic bone is usually more narrow than in the transverse, right? So
between the hips?
Like cross, like diagonal. If you thought about your pelvis like in the diagonal angle,
you have more space there.
You have more space. So what happens is the baby usually rotates after the head comes out and rotates so that its shoulders can come through that diameter. And for some reason, these babies sometimes don't. So we talk about it a lot, oftentimes about size, but it's more often about that rotation that really has those shoulders get stuck.
Yeah.
So what we're taught in midwifery school, and please correct me if I'm wrong, but I think that one of the reasons why they're so fearful of it in the hospital is because 95% of women are on an epidural. So trying to change a maternal position on someone who's an epidural is very difficult.
More challenging.
Yeah. So in midwifery school and in our learned skills, what we learn is to change the maternal position immediately. So whatever position she's in, if you change her position, oftentimes it can dislodge that shoulder and take it into that the oblique diameter.
Right.
And then we can just call it sticky shoulders. We're like, oh, just kind of popped out.
Sticky shoulders.
Yeah.
Sounds like you need some like Pam non-stick.
Sometimes you're wishing for it.
Some Pam
right?
Dystocia spray.
It definitely sounds like in your scenario that you described, it was a lot more than that because they tried to change your position a few times. Sometimes all we have to do is have a woman stand up, lift up a leg. Sometimes if they're in the tub, just getting them to step over the tub can dislodge. So oftentimes you'll have that initial like, this might be a stuck baby, and then you do those things and the baby comes out. Once you put your hands inside of a mom and try and do the maneuvers that we've been taught, that's when we would really consider it a true shoulder dystocia. And I, in terms of my learning and my experience, it's not necessarily equated to a long push. I've known lots and lots and lots of people who have had long pushes, and it has not resulted in a shoulder dystocia. And I've seen sticky shoulders or shoulder dystocias in a very quick delivery as well. Sometimes just that when babies come down really quickly,
they didn't rotate properly.
That's what I heard.
Well,
is it's more common if the baby's born really fast.
Yeah,
because it doesn't have time.
It just doesn't rotate at all.
Right.
Yeah,
because they should corkscrew, not just come down, but come down and rotate at the same time.
I just wanted to, I know that is the obstetrical training, and that's kind of the fear around it, and then we end up not allowing women to push for an extended period of time because we believe that, And I had a 6-hour push one time, and I felt that woman's band, and I was like, this thing's not going to ever move. And I was like, thinking, wow, this is going to be interesting. And after hours, it softened and it melted, and it, and that's not the case for everyone. But it's interesting when you give the body time, what happens. As long as mom and baby are still sounding good, if we just really allow the body to do what it's meant to do, the majority of the time, things are going to move forward.
What do you use to cut the pubic bone open?
Yeah.
Is what's
this
going
really
chainsaw.
Yeah, like this really funky instrument that you don't want to see.
Oh, wow.
Yeah.
Sheesh.
Yeah,
Really
there's one last one too that I've seen this happen one time called the Zavanelli maneuver, which is where you actually try to push the baby back up and then go do a C-section. Yeah. And that also never ends well. That's like not a
right, because,
situation.
Yeah. Wow.
But yeah, I mean, I think a lot of it obviously in your case, actually, it wasn't for lack of movement and doing all those things. But I think a lot of time in the hospital, I think it's more that immobility factor, that people really get stuck. And then, and then with an OB, it is hard to convince your OB to go past, 3 hours. It's just going to be really hard because they're just afraid. And it's just one of those things where is that if something were to happen, then it would always be like, why didn't you just do a C-section?
I think it's a dual fear. I see it as a dual fear. Usually he or she, the obstetrician, is worried about liability, which is risks to the provider, but also medical risks. They also want the best outcomes for the patient and for her baby.
And I mean, and a lot of people see a C-section as a perfectly fine way to have a baby.
Yeah,
you know what I mean? So it's
no downside. You're saying no downside.
When it's used appropriately.
Absolutely.
Right.
Yeah, it saves lives.
So
so the question from the OB mind is, why would we even go another 20 minutes if we can just do the cesarean with no downside?
Yeah. Yeah.
No downside
so it's
being,
yeah.
I'm saying in their mind, no downside.
Right.
Sure.
But in your
their
mind as a
mind, exactly.
patient, there might be a downside.
Yeah.
And
long-term health for the mom, there's a downside from major abdominal surgery.
That's,
of course.
that's
There's
something to
lots of
take into
downsides to
account as well.
C-section. Yeah, for sure.
So, Ash, flash forward to how old is this little guy?
Gus is 2.5, and
Right.
Odie is I don't know.
She looks at me.
11.
She looks at
well,
me.
you were there. I think it was like 10, 11 weeks
10 weeks ago.
I love you, but I don't know how old your baby is.
Yes. So
I don't even know what the date is today. I don't know.
you were
He's
not
like-
traumatized from your birth,
From my Gus birth.
from your Gus birth. Not traumatized. Was Neil traumatized?
No, nobody was.
Nobody
We
was.
felt great
was
about
Phil
it.
traumatized?
Phil has
on
his
the treadmill.
issues.
Yeah.
he still has his issues.
Now he does an hour and 20 minutes a day on the treadmill. I mean, 2 hours, 120 minutes.
Yeah, I mean, it's hard. It's, I was an extremely well-educated home birth client. I had been studying home birth. I'd read everything. I'd attended multiple, I was very, very well informed. And considering Cedars was less than 3 miles from our house, I had had a completely normal pregnancy. I wasn't overdue. All the heart tones were good. I think the choices I made in the moment, I didn't consider dystocia. I mean, anything could go wrong at any moment, and in hindsight, I don't really know what I would have had. If I'd known I was going to have a dystocia, would I have had a home birth? No. I think I would rather have been in the hospital with a dystocia. At the same time, I think Gus would have been taken to the NICU just for policy reasons, and I wouldn't have been able to hold him for like 4 days, and that would have been a huge bummer for all of us because he was completely fine after the dystocia. We did some cranial sacral stuff just for fun.
That's always fun. But you said, so if you knew it was going to be a dystocia, that you probably would not have done a home birth.
Right, but there's no way to know ahead of time if it's a dystocia.
Right, so that brings me back to your second pregnancy,
Well,
your second child. And
yeah, so we opted to do a hospital birth the second time because there was a and this is a quote, 0 to 25% chance of a recurring shoulder dystocia, which was a sort of an infuriating statistic.
Yeah.
But I didn't want another dystocia, and I would have happily done a C-section. By the way, if I had had any kind of issue, I don't have anything against C-sections. That's great. I'm so glad we had the option. I think that's a miracle.
Sure.
And
by
also,
the way, the people who spend like ages going through school to perfect them and be able to deliver them
Exactly.
in a gentle way. I mean, just because it's a cesarean doesn't mean it can't be a gentle birth as well, and a magical moment as well.
Yeah.
So,
oh my God, are you so hungry?
I know. Did that just come out
Does
on the
anyone have a power bar?
wait a second, but
Dr. Hill's
Hold on.
stomach has
Gus
a
is-
thing or two to say.
Gus isn't
missed
here
lunch
anymore.
today.
So I was like,
I know.
where's it?
Poor thing.
We should get another mic.
Yeah. I know. What was funny was I didn't really know how serious the dystocia was until I started meeting with OBs for my second pregnancy. And they asked me if I'd had any issues with the first. And I said, well, he had a little trouble coming out, but he was great. And pregnancy was totally normal. Everything was great. And, and they said, well, was it a dystocia? And I said, yeah. And one of the first OBs I met with in Manhattan. We'd moved to Manhattan, and he's a very, very famous OB, and I'm not going to say his name, but
it rhymes with.
No, I'm not going to do that. But he's very, very well known for being, option friendly, is what I call it. Where he's aware, he wants to inform the women of all of their options. He's not big on intervention, et cetera. And I said, well, do you think the dystocia is, an issue? And he said, to be honest, I can't believe you had the balls to get pregnant again.
Whoa.
Yeah, it was a big moment that he said that to me, and he said, well, I can't take you as my client unless you're going to do a scheduled C-section. He said, that's just not the practice I have here. And I said, you're the most liberal.
You're the option guy.
Yeah. And
is that the normal? I mean, is that what's typically done?
I don't think so. I mean, I think the thing about second birth is that it's so different than from the first time. It's like if it somehow came out the first time, it's probably going to come out the second time. Mm-hmm. I mean, I've had patients who've had dystocia and have requested a C-section the second time, but I don't know that that's necessarily the standard just to do that.
So you wouldn't necessarily urge them to have a C-section?
I would more say, let's follow your labor, and if it goes off track, off the normal, quote unquote, then we'll consider it,
So this is what's amazing about you and amazing about you. But, I mean, considering you work in a hospital, very well-known, amazing hospital, I went to 7 different OBs in Manhattan, and I couldn't get anyone to say those words to me.
Really?
Yeah.
I mean, I just feel like to me, the greatest patient ever is the second time.
Right.
Yeah. It's like, once that, right? I mean, once that path has been carved, it's like,
yeah. And Beth
golden.
Cannon, who was my midwife the first time, Beth Cannon said to me, you have a proven pelvis.
Mm-hmm. Yeah.
Don't let anyone try to tell you don't.
Right.
A baby's gone through there already.
I mean, the second time around, it is night and day. I shouldn't say that. I'll have to wait and see what was the outcome the second time.
Oh, you don't know.
No.
I don't know.
Inquiring minds want to know.
Bliss knows.
This was there.
But that was in. Oh yeah, go ahead.
I just want to interject because it's on my mind. Is like we have been trained, OBs and midwives. We're trained to handle the emergencies because women are mammals and we're designed to have babies with no one around. I mean, that's our design. We had babies forever before the medical, field intervened, right, and became involved. So we're trained to be able to help mothers and babies when there's an issue. So we're trained in dystocias, we're trained in hemorrhages, we're trained in these things so that if things do go off course, we can support you with that. So, we don't ever expect we prepare for, but we go in thinking most of the time everything's fine. And if something goes off course, we have the skills to be able to manage it.
Well, usually I think if something goes off course, you have time to transport. But you're saying something goes off course at the end.
That's not necessarily true about a home birth. That's saying that midwives don't do anything, right?
No. I'm not saying that midwives don't do anything. I'm saying that midwives, when you're in the middle of a labor and you see things turning pink flag, do you stay home and see if that's going to turn into a red flag?
No.
Do you transport?
No. But in a dystocia, you don't have time.
But
and
that's
in
what
a
I'm
hemorrhage,
saying.
you don't have
When
time.
things come up at the very end,
right?
But that's rare. Is my point.
Yes.
And when things come up in the middle, then you transport, which is what makes home birth safe. You don't stick around waiting to see, let's see, roll the dice and see how this is going to go.
Exactly.
But with a dystocia, you don't have the time, but you have the training.
Right. But I think I just wanted to say is that that's our job. That's what you hire us for, is to be prepared, to know these things, to have the skills, to implement them and step in and use our skills when these very, slim chances come up that we need to use our skills. But we have them so that we can support people in these situations.
I mean, when we had our home birth, our midwives came in. I thought I was watching an episode of MASH. They came in with all these duffel bags of medical equipment with the Red Plus on it. I was like, where's the chopper?
That's what we studied for. So anyway, second birth.
So, but you went through 7 OBs in New York.
In Manhattan.
And I can't believe he used that terminology. I can't believe you had the balls to get pregnant again.
It was awful.
Because maybe I could believe if he said that to Neil.
Yeah. Well, yeah. I mean, so finally, and I was going, Abby Epstein is a friend, and she was like, here are the people you need to go meet with. These are our people,
and they all said no.
And they all basically said, we got to schedule a C-section.
Too risky.
Mm-hmm. And then I met Sylvia Blaustein in Manhattan, and she said what Dr. Hill said. She said, I think we got to feel it out. And we got to see how it's going, and we're going to have to make a game day decision, which is all that I was looking for. I was looking for options. I was put on a very, very, very strict diet. I basically only ate protein and vegetables. I had no fruit. I had no
Is this
rice.
so the baby will be smaller? How
hope
big was Gus?
Gus was 8'8".
Okay.
The hope was that we would build a small baby from the bones. So that started at like 5 months. I had no rice. I had no potatoes. I had no bananas. I was so
I sort of feel like I should try the Dystocia diet. I'm just saying.
The anti-dystocia diet.
Recommend it. I don't. It was miserable. I was a big, huge grump. It was like just peanut butter and carrots, It was just terrible. And then when I was 6 months pregnant, I'd only gained 4 pounds.
Wow.
So they were like, no, eat more. Like, don't be crazy. And then, of course, I was like, okay. And I gained 10 pounds in a month. And they were like, stop eating. And I was like, no. So I had to go back on it. Anyway, then my husband got a job in Hawaii, and that sort of obliterated the Blaustein plan. But before that, I came in for one of my prenatals with Dr. Blaustein, who's an incredible midwife in Manhattan. And she said, so, I know we're doing the trial of labor, but I do need you to sign this thing that says that we've advised you to have a C-section, but that you're declining a C-section.
Oh, even though she didn't advise you to have a C-section.
That's right. And I said, what? She said, well, I work under this doctor, and he needs you to sign this. But I'm going to let you have a trial of labor, but you have to sign this thing saying that we don't think you should have a trial of labor. And I was like, I can't sign that. No. Do you want me to have a C-section? Because if you want me to have a C-section, I need to go home and consider that, because that's valid. If my care provider does not think that a trial of labor is safe, legally or otherwise, I need to consider that seriously, And then luckily, 2 days later, my husband announced that the family was being transferred to Hawaii to make a movie. And I was like, great, peace out, New York, because this is not where I want to have a baby. So I got to an amazing Castle Medical Center, it's called, in Oahu. If anybody needs care there, they were incredible. There's a whole midwifery team there, and they were really excited about the Dystocia, and they were like, we're great, we know how to do Dystocia, and it's scary, but we know what we're doing, and this is going to be great. And then my husband's movie fell apart. I was like, oh my God.
The adventure continued.
What week was that you moved back to LA?
It was I was like 35 weeks.
Yeah.
I think. Yeah.
Oh my God.
And what week did you move to Hawaii?
Airline. We moved to Hawaii when I was, 7 months or something. We went to Hawaii.
It's like 28, somewhere 28,
Oh, no,
30?
it was 32 weeks when we arrived in Hawaii, and I was 35 weeks when we left.
Okay. And then why did you come to Los Angeles?
I came to L.A. because Dr. Goldberg was here.
Mm-hmm.
That's his name.
Yeah, that's his name.
Yes.
You guys, it's a lot. Yeah,
Mommy brain is real.
It's not like you spent a whole pregnancy with him.
I mean, I don't want to I feel like anti-feminist saying mommy brain, but like it's kind of true.
I hear you.
So yeah, it's kind of true. I also think mommies are the most brilliant, smart on their game people. So that's why I say, I don't want to say that I'm like a dum-dum, but I don't remember anything. So I'm like, I'm concentrating on naps and breast milk and all that. So I came to LA, and the first thing I did was I texted you, and I said, Dr. Goldberg famously is not scared of dystocia. He knows exactly what to do.
So what you said or what I said?
I knew that.
Oh, you already knew that.
I don't remember how. But I said, I got to get Goldberg to be my OB. And I knew you guys were buds. And I was like, I need you to text him right now and tell him to take my case. Because the lady was super nice, but she was like, you're 35 weeks.
When you called his office?
I called his office and she was like, we're super booked. And I was like, no, I'm really fun. I was like, write this down. Write down, I'm really fun. He's going to love me. And my labor's going to go so fast. And we're going to have the best time ever. I was like, please write that down. She was like, okay. And then I texted you and I was like, you gotta call him and tell him that he has to take me. And within 2 hours you wrote back and you were like, he's taking your case. And then I just started crying. So yeah. Right. And then I heard about Bliss through the grapevine because I'd heard about Monetree's services and I was really excited about that. Because again, I was a little scared about prodromal, but also, I was also kind of scared about precipitous birth. I was like, I don't know, second baby, who knows,
So just in English, afraid it might go too slow or too fast.
Yeah, I'm afraid of everything.
Right.
I'm afraid of dystocia. I'm afraid, so.
And monitress is basically a midwife or a nurse who can support you at home and then help you be at the hospital like a doula.
She can monitor you, though. So she can monitor your cervix. She can monitor everything. Your baby.
Yeah, exactly. So that's when Bliss and I teamed up. And it was love at first phone call. And I was like, you're amazing. We're done. I'm hiring you. Bye. I'll see you in 2 days when I arrive in LA. And you came over and I just cried and told you I was terrified. And, I think I was scared at that point. I'd had so much advice telling me that a trial of labor was crazy. But I knew, I said, listen, I'm not a crazy person. If I'm overdue, if my baby's measuring enormous, if I push for more than 30 minutes, I'm done. Yeah, let's just go into surgery. I'm done. I don't have anything to prove. But I do feel like there's a chance, a very good chance, that this baby could fly out of me and then we'd have no surgery. We'd have no one in the NICU. We'd have it would be awesome.
Well, based on the numbers you were quoted, it sounds like you had a 75 to 100% chance.
Right.
That's the trippy thing.
Right.
And when I looked through those studies, it was, it's like your numbers increase if you're overdue, if your baby's measuring big, if you've pushed for more than 2 hours, if there's a turtle sign, your chance of having a dystocia goes up. Like if you're having a dystocia, your chances of having a dystocia go up. Like it's just the statistics are so weird. And listen, I have nothing against C-section. I was all for it, if I needed it. But I was like, what if I don't need it? Yeah. Then we're doing unnecessary surgery, and it's super hard on all of us. And let's just see.
And Dr. Goldberg met with you.
So I went into Goldberg, and he was like, first of all, you're going to be fine. You're not going to have a dystocia. Second of all, I'm going to get my hands in there, and I'm going to maneuver the shoulders, and you're going to be fine. And he wasn't scared. And I was
when you came out of his visit, you sounded on cloud nine. You just sounded like excited.
It was like coming home.
Yeah, because you'd spent 30-something weeks trying to find support, and you just came out of there.
And being with a care provider, he's an extremely confident individual, and as it carries through to him as a doctor. And I needed that, and I trusted him immediately. And I have feelings about a hospital birth. I didn't love it, I didn't love the prenatal meetings. My prenatal meetings with Beth Cannon's crew, with Laura Monroe and Julie Anderson, they were 2 hours long. They were childbirth education for 2 straight hours. Now, listen, second time around, I kind of don't need it all, but I definitely was like, oh, this is a 4-minute meeting with my OB.
Remember when I had you go to that chick for internal body work?
Oh, my God, Priya. She came on Mother's Day.
On Mother's Day.
Gave me a vaginal massage for an hour and a half.
That was
Cannot recommend enough, ladies.
I'm already signed up.
Seriously.
I am.
Yeah.
Good.
Oh,
I'm
you are?
glad.
Mm-hmm. Oh, fantastic.
I was like, what do you need? She was like, just put a towel down, take your clothes off. I was like, well, let's go.
Because afterwards I said, how'd it go? And you're like, best Mother's Day ever.
It was awesome. I had a lot of fear that my pelvis was dysfunctional when it came to birthing.
Right.
And I was worried I was locked up. And we had an extremely intense, my mother died when I was 5 months pregnant, and I had a lot of trauma. We had Gus got burned. We were in the there was all kinds of things went wrong during my pregnancy, and I was scared that tension was locked me up, and I believe in that.
Well, and also all the people telling you that you shouldn't do it.
That was big.
I'm sure that emotionally you're carrying that somewhere.
That was big.
Yep.
So I did a lot to prepare. I came to you a lot. I hired Priya, who did a lot of releasing sort of in my pelvis. And
so I can release your pelvis from the outside.
Yeah,
the
she
muscles
was
and
releasing
bones
from
of
the
your
inside.
and that's why I recommended that, is because I can't get to your pelvic floor.
Right.
And if it's really stiff and rigid, it makes sense that it could slow things down for you.
Mm-hmm.
I have to tell you, she told me that she didn't do much.
Really?
Yeah, because you were a lot more relaxed than you assumed, but it gave you the confidence
Totally.
to have someone evaluate you and say, you're good.
You're
Right.
okay.
Yeah.
As soon as her fingers, she put a glove on. Her fingers were inside me, and she said, "You're going to be fine.
Mm-hmm.
I can feel there's a lot of space in here." And I immediately went, "Oh, thank God."
Just
and
having
that
that
alone,
confidence,
that
I think,
alone.
is such an important thing. I mean, I've had patients tell me, the first time I went to a gynecologist, they're not even pregnant yet. The first time I went to a gynecologist, they told me that I'm going to have a hard time having a baby. You know what I
so
mean?
hard
Or they'll
to tell
say
women this.
your pelvis is tilted, your hips are so small, those seeds get planted in people
And I think
decades before
I
they
think
even.
that translates into real tension.
I think it does
really
too.
do.
I think it's such a disservice, and doctors, I think, say it's so flip to them, oh, your pelvis is so tiny, you'll never have a baby.
That gets locked
And
in
you're
your
just
head.
then you're living that for the rest of your life, And I've had patients tell me that as they're in labor,
Totally.
I knew I'd never be able to do it, or and it's oh my gosh, the confidence is just gone.
Yeah.
Well, I mean, my internist said I have great hips for birthing.
Yeah.
So
I've never been worried about you.
thank you. Yeah, I've never had a dystocia.
Yeah,
so
see,
it
if
must
only,
be true.
If only I had that.
So how did your birth go?
So it was good.
Yeah.
It was fun. I mean, it's also
It started with water
it's also like a
breaking.
living nightmare, but it was great. I mean, just giving birth is just so radical and crazy, and your
Did
whole
you make a
body
new
turns inside
playlist?
out.
I mean, that's sort of
I
important.
used the same playlist.
You did? Okay, it worked.
Oh,
So
that's awesome.
yeah. So I was in
probably
the
only got through
library.
it.
That on Pandora as
Sure.
the childbirth.
Oh, Ashley's childbirth mix.
Yeah.
That's not a bad idea.
Ashley Station.
popular.
Pandora, get in touch with me on Twitter. So I was in the library and I sneezed, and I was in the children's section. I sneezed and I felt something kind of go I don't know, but I had had a very weak. I'd been sort of peeing in my pants since was maybe 5 months, just sort of a weak pelvic floor. So I felt something, but I was I probably peed a little, who knows? And then I got in the car and I kind of felt it again. And I was I think it's possible my water broke, but I'm not sure. And I wasn't feeling anything, but I couldn't tell. It was a leak, just a leak, if anything. And and I was I know that it can reseal, and I know that, and I was early. I was 11. It was 11 days early or something, right? I don't know. She's it's not my job. So I was early. So anyway, I went home and I was starving.
Again.
Could have eaten, kind of thing where you eat and you're so full, and then you're I think I need a power bar. You know what I mean? It's binge level. I just could not stop eating. And I think I texted you and I said something's happening, because I was just feeling things, but I wasn't really sure. And I went for a walk with my girlfriend from college, and I kept stopping during the walk to be God, I just feel I want to puke. But it's not a contraction, but it's just, life is just getting me right now, and then I'd be fine. But it was kind of an emotional contraction or something, And then I went to bed, and at 4 a.m. I woke up to eat, and I was just hungry. And I had to write, it was my husband's birthday, and I had to write him a card. And so I sat down to write the card, and amniotic fluid started leaking all over the little cushion that I was sitting on. And so I wrote him this card, and I just said, say bye-bye to your birthday, buddy. Because you got company.
You got a birthday.
Yeah, for the rest of your life, you're going to have the same birthday as your son. Anyway, and then I texted birth because I really wanted to confirm that my water had broken.
Bliss. Or birth?
Oh, what did I say?
You said birth. You texted birth.
I texted birth.
Yeah.
That was kind of what I did.
I sometimes Snapchat birth.
I texted Bliss, and so she came over and confirmed that it had broken, and then I said, okay, well, I just don't want Pitocin, so now I just want to be in labor. So I'm going to walk. I'm going to, do everything. I don't think I went to acupuncture. I think I texted Jason and asked if I could come in, and he was booked or something. I can't remember what it was, but I started walking a lot, and I was just, I just did not want Pit. So
because no contractions yet.
No contractions, nothing. So I was like walking, and my husband really wanted to go to this reading of our friend's script, and so he went to that, and I pretended it wasn't happening, but also was like, let's go. And then I think contractions started around like 1 p.m. And then at like 2, I was like, I think I'm going to die. And Bliss was like, great, I'm going to come. And
that's my cue.
Yeah. She showed up, and I was like moaning like a horse. Like I sounded like a horse.
Like a woman in labor.
Like a woman in labor.
Right.
But I was like not, like my eyes weren't focusing, and I kept being like, oh my God, my eyes are doing this thing. Where it was like this, where I was like not in my, I was just on a whole other level.
Labor land.
Yeah. And I was like, I think I need you to check me because this feels real. And again, if I'm only 1 centimeter, I got to go. I need an epidural because this is inhuman what this is feeling. It's like I'm being cut in half with a chainsaw for a minute every 3 minutes, and I'm dying. And so Bliss checked me, which is the benefit of a monitrese service. She checked me right there on my bed, and I was 7 centimeters.
Sounds about right.
Yeah. And I was like, let's roll, girls. Let's go. And then it really ratcheted up.
Yeah.
Once I knew I was 7, I was like, come on, baby. Yeah. I can't wait to meet you. Let's go. So then I had like 3 contractions from my bed to the car.
Oh, wow.
And Gus was there, and Gus was like, Mommy, are you going to have the baby right now? And I was like, stop. I mean, I was honking. It was the most crazy sounds coming out of me. And but I didn't want to scare him. I was like, I'm fine. And so we got in the car, and I was like, I need to face backwards in the front seat. And then I like flipped myself, and I started to reach for the seatbelt, and I go, this feels very unsafe. So I flipped back around, and I put my seatbelt on, and I just was like this, just sort of holding myself suspended because the pressure was so intense. And
I couldn't sit.
And Bliss had told me that he was a little high.
Were you
Maybe
in the
you
car
hadn't
too?
told me.
What'd you
No,
say?
she took her own car.
Oh, you
I followed closely.
Trailing
Yeah.
behind.
Followed closely. Just in case.
But I wasn't pushing.
Nope.
I wasn't like pushing with my moans. I was just in pain.
Very active labor.
Yeah.
Yeah.
And then we got into the parking garage and miraculously found each other because I think we told you to park in the wrong place. Or
Well,
we
I think
parked
I
in the
told
wrong
you guys
place.
to walk up, right?
And you said to walk
I
up,
said
but we
walk
found
up.
you in the parking garage. And I basically just hopped from car to car, car hood. It was like I was like, I want the Mercedes, and I would go flap down on the hood of the Mercedes and have a contraction, and then get up again and walk another 10 feet and flop down on another hood of a car. And then we got in the elevator and we went up, and I flopped down on the desk on the 3rd floor in labor delivery at Cedars. And the woman goes, who is this? And I was like, oh. And Neil was like, this is Ashley, and she's in labor. And she was like, I need your, I don't really remember
Insurance
this.
card.
I need your insurance card. And I was like, oh my God. She was like, just go to room 7. And I was like, does it have a window? She
The
put me
important
in,
stuff.
and, I just remember the amniotic fluid was just sloshing in my flip-flops because they had like divots. And I was like, this is disgusting. And this nurse was like, grabbed me and was like, it's not disgusting. It's amniotic fluid. And I was like, it's squishing in between my toes. It's disgusting. And I was like, ugh. And I got in, I flapped down on the bed. And then I think we found out that Dr. Goldberg was stuck in like a parents' night at his school.
And you should have seen the residents' faces.
Everybody was terrified because then
Not me.
they looked at you weren't.
I was, and I'm like,
I don't know what Neil was doing. Yeah.
Catch this baby.
Well, yeah.
Yeah.
And, because I said, the previous birth was a dystocia, and, or somebody said that. And then, I don't really remember, but there was a lot of fear around that. And they immediately
Not from you,
were
from the hospital staff, you're saying.
Well, I think
Did you get afraid?
was started to get scared at that point.
I wonder.
You were pretty deep in your
Trance.
Yeah, and I really I was very protective. I kind of got up on the bed with you, and I was just
did.
hovering around her, like we got this, just really trying to protect the energy. So I don't think you were super aware that he wasn't.
At one point,
that
one
we were
lady.
I'm like, how long is it going to take him to
Right.
get here?
But one of the nurses said, "How long was your last dystocia?"
Oh, yeah.
And I looked at her and I was like, I can't talk about it right now.
Not a good time for a
A
conversation.
few people asked about the last experience, and it was like, I don't
I was
see how that's
literally
going
like,
to
is
help
it not
right
in
now.
the notes? Like,
Yeah.
go
Right,
read the
right.
notes. What are we
Yeah, let's not really relive that right now.
Right,
And totally
exactly.
take the
Can we
focus
not-
off of what's
yeah.
going on here.
It was a dystocia. Like, be prepared for a dystocia. And then they were like, well, Dr. Goldberg said a thing. And I was like, all right. And so then the resident came in, and she was very sweet, but she looked like 11 years old to me, which I know is like a joke that people say, but like she
really looked like
she looked really young. And I was like, she's way too cute. What are we doing? And she was like, do you think you can wait? He's like 8 minutes out. Can you wait? And I was like, I remember saying, I'm not doing this. I'm not in control of this. I'm on a train and it's going, and I don't know, and she left and she came back in head to toe. Like, it was like, she looked like an exterminator.
Hazmat.
Yeah.
And she had this
Shield.
visor.
She's the beekeeper.
Yeah, she
outfit
looked like
on.
a beekeeper. And she had this thing, and she had gloves, and she walked in and she goes, I'm prepared to deliver your baby. And I looked her up and down and I go, I yelled out, where is the midwife on call? And I was like, Bliss is here. I was just like, no way. Like, no way is she going to deliver my baby. No freaking way. She's too scared, and she's finding it too fascinating with the outfit. You know what I mean? Like, she has an outfit, and I just couldn't handle that. Anyway, I don't remember, but at one point you whispered in my ear, Dr. Goldberg just got here, and I just went, oh, thank God. And then he literally was just like, all right, let's do this. And I like opened up my legs, and I was like, I really think I need an epidural or a C-section because I can't do this. And he said, okay, well, I can see the baby's head. And I said, it's my right to have a C-section. I can't do it. Like, that was when the fear took hold, because I was getting so close to having to push.
Yeah.
And I was so scared that if I pushed, I was going to hurt the baby.
Yeah.
And I my body didn't want to do it. I'm totally crying. I'm such a freaking actress. I was like, don't cry. You're not going to cry. I was a soap actress, whatever.
It's emotional.
It was really emotional because I was like, my body is so powerful that I think I might hurt this baby, and it was sort of like the awe of the push, and how the push was, I could feel the push like this crazy, strong current that was violent. It was like a violent push, and I was like, it's going to hurt him, And he was like, look at me. You're fine. If you he goes, he's going to be here in 90 seconds. But you got to push. And I was like, I don't want to. And he said, look at me. You're fine. I've got you. And right then a contraction was coming, and I just went for it. And he was like, that was piddly. No. He was like, I really mean it. He was like, you're still like, holding back,
Yeah.
And I was like, well, I'm scared. And he was like, stop it, go. And I went, from sort of my depths, and I think that he came out, right?
It was a pretty easy push.
It wasn't.
I mean,
yeah.
For you, I get that it was a lot, but in terms of like us that see a lot of births and all of
It
the
wasn't
concern, your baby came out fairly
very easily.
Yeah.
There was no stickiness.
No.
There was no nothing.
Yeah.
No.
He kind of flew.
So you went from the 6-hour pushing to the
To no
1
pushing,
minute
to
pushing.
one
I think I
push.
pushed 3 times.
Yeah, it was really beautiful. And that's I was so happy that you got to have that experience so that you could
It was extremely
reclaim
healing.
your body. Yeah.
It was extremely healing. And when he was on my chest, I just kept saying, like, is this real?
Yeah. Why was that so easy?
Yeah, totally. And also, like, 10 months of fear.
Yeah.
You know, like, just so much fear over in about a minute and a half. And I just kept saying, is this really happening? And looking down at his wrinkly white body, and then he started crying. And I just grabbed Neil, who I wanted nothing to do with during my labor. I was like super annoyed by him. Love my husband. Super annoyed by him when I was in labor. I don't know why. I just wanted bliss. But I just grabbed him and I just kept saying, Neil, 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 Neil. You know, it was awesome.
Happy birthday.
Happy birthday, Odie. And that's when Odie was
Neil.
born.
And Neil.
And Neil. Oh, yeah. Oh, yeah, him.
Yeah.
So that was it.
Oh my God. So it was true. Like the second time was,
Flew out.
yeah.
All
See?
good.
Which was my experience too, by the way.
I mean, it's always my experience.
I didn't-
Your personal experience?
my personal
With
experience.
your birth.
I didn't have a dystocia, but I did push for 5 hours. I transported to the hospital, had a forceps delivery. So, I got an assisted delivery. And I remember that feeling of feeling like history was going to repeat itself. In that moment, trauma lives in our body. And no matter how much we prepare and how much we think that we've gotten it out of the way, that moment of truth when you're right at that same moment that the trauma happened last time,
Yeah.
you have to be able to walk through that. I got goosebumps. And then you get to experience yourself and birth and all of that from a completely different perspective. So, yeah, it's beautiful. I had a
was
2.5 hour labor with
Your
my second
second?
one, and my first one was 36 hours and
forceps?
5 hours of pushing. Yeah, totally different experience.
But that's interesting. They're kind of similar.
Yeah,
Your first long, second, yeah.
yeah.
Well, you got me a little teary-eyed. It could just be this menthol blower, but
Hey, I've used that.
we all
Don't
do.
knock it.
All right. Thank you.
Thank you.
Thank you for sharing that.
I know. That's great.
It's so
That's
personal.
Awesome.
Oh,
and
good.
Sorry to hear.
Good.
It's inspiring, I think the recurring message all the way throughout is that you have choices, and 0 to 25%, it's hard to make a decision for somebody on that, I think that really ends up being your choice.
Absolutely. A trial of labor was important to me, but that's coming back around to my first point is sometimes when you know a lot, it's more scary because I think if I didn't know anything, I would just say, oh, let's just have a C-section. I wouldn't know about the risks of a C-section and the disadvantages of a C-section. But knowing that I would love to avoid a C-section if possible actually made for a really long, hard pregnancy, when normally I think I probably just would have scheduled a C-section, but I wouldn't have had that incredible birth experience.
I think the moral of the story is it's sometimes good to have a crappy acting year and your agent drops you. You become a doula.
Totally.
All right, we've come long. Thank you so much for coming, Ashley, and sharing your story. Where can we find each of you guys online? Anybody?
I don't really do. I'm so
You're not
bad
online?
at social media. No, I
Wow.
am. It's I'm on Instagram. I'm the Smash. I am the Smash.
Oh, okay, that's you.
It's dumb.
That's
I gotta
you.
change
Keep
it.
sending messages.
But I want to know the story behind that another time.
Ashley.
Totally. I
Ashley.
know.
I'm the Smash.
And I'm Birthing Bliss, so you can find me on Instagram and
BLYSS.
BLYSS, thank you, and birthingbliss.com and also on Facebook.
Maybe that's why. Oh, birthingbliss.com and Facebook at Birthing Bliss.
Yeah.
Maybe that's why Ashley texted birth. Because you're
Maybe.
birthing
I think
what?
that's what it was. Went through my contact list. So.
And your book, Dr. Hill, Your Pregnancy Your Way, Everything You Need to Know About Natural Pregnancy and Childbirth is a great book. I started recommending it to everybody. In fact, people pick it up in the waiting room And they get upset that we only have like 4 or 5 minutes of wait time. Like, no, this is a really good book.
Oh, that's nice to hear.
I'm still waiting for my copy.
I know. If I would have known you were here, I would have just brought it along.
Go buy the book.
She told me she was going to send me one.
I know. And I have your stuff sitting right there next to a book. And I'm trying to figure out an envelope.
You're so cute.
So
I'll come
silly.
and get it.
All right. Thank you for listening to the Informed Pregnancy Podcast. Share us with your friends and visit us online for access to our blog, documentaries, and other pregnancy and parenting resources at informedpregnancy.com.
Doctor, give me the news. I got a whole lot of questions for you. This kid's gonna test my will. I got a lot to learn, and my babies do.